Good evening, viewers. My name is Dr. Shola Akini. Today we continue our Feminine Talk series. We are still on Module 1, and the topic is menstruation and related issues. For this session, we'll be discussing scanty menstruation and heavy menstruation. I like to recount a little bit so that we can have a background. We realize that there are principal issues that govern menstruation. I would summarize by saying 4 areas and 2 hormones. 2 of these areas or organs are in the brain, and 2 outside the brain. The areas in the brain are the hypothalamus and the pituitary. Those outside the brain are the ovaries and the womb. And the 2 hormones that govern menstruation are estrogen and progesterone. So these 6 things are very important in our understanding of menstruation and the problems that may arise with menstruation. And so we keep that in view. It is so important for us to be able to relate with these areas and these hormones because they directly affect the menstrual cycle. Even when they do not do so directly, most external factors, including drugs and the environment, affect the these 2 hormones, or the hypothalamus, the pituitary, the womb, or the ovaries. So we go to we'll treat the first topic, which is scanty menstruation. This is also called light flow by some ladies. The first, like we used to do, is to relate this type of complaint to the age of the girl. When a lady has attained puberty, say at the age of 13 to 16 years, and the first few menstruations, like we said the other time, could be regular, it could be skipped, it could be heavy, it could be scanty. And these are not things to be worried about. They are more or less fairly common with adolescent girls. But aside from this, at the other extreme of life also, when during the perimenopausal time, when a woman is approaching menopause, the last few menses, that is the last few years, say 1 to 2 years, may also have this characteristic, that is, it may be scanty, it may be regular, it may be heavy at times. Why this also is because of upset in the hormonal concentrations or hormonal imbalance, and the fact that the principal hormone in this case, that is estrogen, is no longer sufficient. So at the extremes of life, that is at puberty and during the time leading up to menopause, the women can experience scanty or light flows. Then we go to lifestyles. I want to take us back to the previous talks that we had, that menstruation boils down to hormonal concentrations in normal amount with normal interactions. Now, there are some schools of thought that believe that our daily lives, including our lifestyles, the food we eat, the type of life we take, we live, will affect, may cause upset in the hormonal concentration and cause imbalance. For example, some people have queried sugar, excess dairies, even excess meat, that is meat intake, that this may upset the hormones in the body and cause hormonal imbalance. An imbalance in this sense, we mean either it is scanty or it is heavy. So this is one area we should take care of. And then we know that people who have extremes of weight, that is, you are too thin or you are too fat, may also experience hormonal imbalance. And therefore, our lifestyles, or the lifestyles in young girls and women, also matter. Still on lifestyle and environment, people who indulge in severe exercise, especially, for example, athletes training for competitions and all that, may experience scanty flow. And this is because this is a form of stress. And like I said in our previous talk, stress affects the hypothalamus. So when an athlete is training for competitions and all that, she may experience changes in the quantity of flow. It may be light, sometimes it may not come at all. We will still be dealing with causes of lack of menstruation in the future. I think that should be our in the next couple of topics. The other form of stress that could cause scanty menstruation or hormonal upset includes physical stress. For example, you are a nurse, you've been on morning shift for about a month, and then you switch on to maybe night shift. Your body needs to show in your menstruation, which may include scanty menstruation. Now, aside from emotional stress, aside from physical stress, you also have emotional stress. Emotional stress in the form, for example, a young woman that has lost somebody, maybe lost the husband and all that, or there is a social downtime and the woman is emotionally disturbed. All this can affect the hypothalamus and cause hormonal imbalance. And hormonal imbalance, like I said, in this sense, maybe it could reduce the flow. It could. Sorry for that break in transmission, but like I was saying, emotional stress could lead to hormonal upset, which will make your menses to be scanty or heavy or absent, or sometimes it may not come. It may flow for a long time or only to resume spontaneously when the stress factor is over. So these are lifestyles. Now we talk about diseases and conditions that may affect menstruation and cause scanty bleeding. The first major here is will be hormones in themselves that that affect other hormones, especially the estrogen and progesterone concentrations, either directly or indirectly. And these are forms of hormonal imbalances that could cause scanty bleeding. They could cause heavy bleeding, sometimes irregular bleeding. One of the most common around the world is polycystic ovarian syndrome. This is the commonest cause of hormonal imbalance in the world, and occurs in about 30% of women. And this has to do with the ovaries not functioning well because of hormones that are supposed to govern menstruation and ovulation not functioning well. In this condition, the woman or the young woman has a lot of eggs in the ovaries, but these eggs are immature and they are suboptimal. And she has a lot of androgens, that is male hormones. You know, for one of the things for an optimal female egg is that they should be in an optimal female environment. But in polycystic ovarian syndrome, these eggs are in male-dominated hormonal environment, and therefore they are very suboptimal. Other hormonal diseases or disorders include thyroid, the thyroid hormones or the thyroid gland, which is in the front of the neck. The thyroid gland produces hormones that also play a very important part in menstruation. Variations in the concentrations, either it is too high or it is too low, could lead to scanty menstruation, especially when it is too low. When it is too low, also you could have absence menstruation totally. Then you have a hormone called prolactin. Sometimes these hormones may be in excess in the body and upset the mechanism of menstruation, such that if it comes at all, it is scanty. And aside from this, some women have XX androgen. XX androgen. Like I said, androgens are hormones that are more that are higher in males than females, and that is what makes males males. So when a woman has excess of androgens, it may affect also the menstruation, and it may cause scanty menstruation. Now, there are, aside from hormonal disorder, there are also diseases, systemic illnesses. If you are very sick, sometimes illnesses like this can affect menstruation. For example, somebody that has bled, maybe lost too much of blood, or you are anemic. Of course, you don't have more to spare for menstruation. Some people may have other diseases that are debilitating, and this may affect menstruation. In most cases, making it to fluctuate or changing it altogether, either reducing it or making it to be absent. Now, still on diseases and conditions, there are some in this environment where abortion is common. If a woman or a young lady has instrumentation, especially D&C, and in the process, the lining of the womb, which is used for bleeding, that is the functional layer of the womb, is scraped excessively, this could lead to scanty menstruation or total loss of menstruation, which means that the layer that is shed that comes out during menstruation has been removed mechanically by through D&C. So the consequences of this are lack of menstruation, scanty menstruation because of scars or adhesions. And there are this is common in this environment, and I think it's more or less a disease of low income environments like Nigeria or sub-Saharan Africa. Again, there are some drugs that may cause unintentionally or intentionally cause scanty menstruation. For example, doctors do give oral contraceptive pills for family planning purposes, or sometimes when the menstruation is heavy, doctors prescribe it for to control it, to make it regular, but as a side effect also, it reduces the flow of menses. That is to say, the menses generally becomes less in flow. And there are some people who indulge in herbs, some of which are unspecified in functions. For example, it is not uncommon for doctors to see ladies or young women, especially those who are looking for the fruit of the womb, to insert herbs into the vagina and sometimes into the womb. And the substance goes into the womb, and this causes a lot of scarifications and or scar formation, and destroys the cells of the lining of the womb. And so these are common in our environment, and we should take note of that. So by and large, what I have said now amounts to scanty menstruation. When would you be qualified to say that you have scanty menstruation? Most, if you go back to our definition of normal menstruation in the previous talks, we said that normal menstruation should be at least 2 days and should not be more than 7 days. Therefore, if your menstruation is 1 or 2 days or less, and your flow is light, for example, it will be unusual for maybe you use just one sanitary towel or sanitary pad throughout the whole day, and all you got is a spot, or the towel is not soaked or it's not fully soaked, then you can say that you have scanty menstruation. And by and large, scanty menstruation is far less a complaint than heavy menstruation. So less and less in terms of complaints. More women will complain of heavy menstruation than scanty menstruation. So what are the remedies? Now, like I said, the whole purpose of giving these talks is to interact and pass information. It is not for me to prescribe so that people don't misuse drugs or confront their doctors or think that make their own self-diagnosis. But I would lay emphasis on the principles of treatment. Now, generally, the principle of treatment, what doctors do is to try and look for the cause or the reason why, the reason for the scanty menstruation, and treat it. So the major or the pillar of management here is for you to visit your doctor, to examine, listen to you, examine you, and run some investigations and then decide on the appropriate treatment for you. But what we do basically is to tailor the treatment towards the cause. For young girls, like we said, they feel menses they have for 2 to 3 years before the menstruation is firmly established and becomes regular. They are not complemented by ovulation. So, and for many women also, when menstruation becomes scanty, irregular, or comes in very unpredictable manners, such menstruations are usually not preceded by ovulation. And so one principle of treatment is to establish ovulation. All right? And sometimes change in lifestyle, adjusting your weight. If you are too thin, try and eat more and add more weight. Some obese or very fat women also experience scanty menstruation because of the fact that they don't actually ovulate. So adjustment of weight, that is loss of weight to an appropriate or normal weight, can restore, can make the menstruation to be normal again. Now, like I said, diet therefore is important. Then, like we talked about stress. So if you relieve the stress, or once the stress is over, for example, for somebody that has been grieving, once the grief is over or the grief period is over, you find out that the menstruation may revert to normal without treatment. If an athlete is training for an exercise, or a girl or a woman is undergoing excessive stress, once the stress is modulated in such a way that it is tolerable, then menstruation becomes maybe reestablished to become regular with normal flow and duration. Let me just say a word about athletes here. If you have a friend who is an athlete, and when they are training for competition, they probably will tell you that they don't menstruate. And also fashionistas, those that are models, that are very thin and fashion conscious, may not have full complement of flow. And for some of these people who are professionals, when they want to start their family and they want their menstruations to be regular with normal flow and the cycle length to be normal, they take time off. They take holidays from the stressful schedules, and then everything will be established again. Some people have advocated other measures, including having hot baths during your periods. Well, this is not proven, but of course, you don't lose anything if you try it. Other issues, like I said, in most part, will be tailored towards what you can do yourself. If, for example, you just lost blood, maybe due to an accident or something that is bleeding, well, you need to reconstitute, and your blood volume and the amount of blood circulating in you must be addressed. Remember that blood is so important that it affects, aside from carrying oxygen to keep us alive, it affects so many reactions in the body, which also contribute to our well-being. So somebody that has a shortage of blood, for example, may feel well even before blood volume is restored, because the medicine for restoring the blood will affect other parts of, other biochemical reactions in the body, such that the feeling of wellness starts even before the total healing. Now, so this is about scanty menstruation. As we normally do, we will take questions at the very end. This time around, I've promised that I will take 5 questions. All right, so I hope you'll be one of the lucky ones. So I move on to heavy menstruation. So we have finished dealing with scanty menstruation. So the next is heavy menstruation. Like I said, heavy menstruation is more common in terms of complaints than scanty menstruation. It is like about 30% of young girls and women would at one time or the other experience heavy menstruation, especially those that are in the reproductive age group, that is from the age of 16 to about 44 years. Now, what are the causes of heavy menstruation? I will also like us to revert to our concept of menstruation, that there are 2 areas, that is the hypothalamus, the pituitary gland in the brain, then 2 areas or 2 organs outside the brain, that is the womb and the ovaries, and then 2 hormones, estrogen and progesterone. Everything that we talk about menstruation and every problem about menstruation could be directly or indirectly traced to these 6 key points: hypothalamus, second, pituitary gland, third, the womb, fourth, the ovaries, fifth, estrogen, sixth, progesterone. So these 6 are important. So heavy bleeding. Now, age also comes into play. Like I said, the first few menses from a young girl may be uncharacteristic. It may be heavy. It may be irregular. It may be scanty. So heavy bleeding may also feature in young girls that have just attained puberty. Now, sometimes also at the very end of the reproductive life, when a woman is attaining menopause, there are instances, even though fewer instances, when bleeding may be irregular, it may be scanty, it may also be heavy. And this is because the ovarian function now is not as efficient as it were because of the deficiency of the hormone called estrogen. Now, we say that a woman has that your menses is heavy if you use more than the average number of pads per day. The average is about 3 to 5, but some people, count in packets, and some have to change pads every hour, and they are fully soaked. And then you have clots, remarkable amounts of clots, giant clots in your in your menses, appearing in the menstrual. That is, when you check the pads, you have blood clots. That is big blood clots. It is not totally out of place to have small clots, but it is not normal to have giant clots in the menstrual flow, or menstrual blood, or menstrual. Now, like I said, what are the other things aside from the extremes of life? Infection is very important in this environment, especially pelvic inflammatory disease is very important. Is an important cause in this of heavy bleeding in this environment. Remember, I said that whatever we do, whatever the cause that I mentioned, this could be traced to upsets in the 6 things that I've mentioned, especially the hormones now. infection can upset the hormones estrogen and progesterone and cause heavy bleeding. Now, many of the heavy bleedings that women expect after establishing menstruation or cycle, that is after the girl has established regular menstruation and then has started to menstruate with ovulation. That is, every menstruation has been complemented with ovulation. This type of cycle is called ovulatory cycle. And then sometimes when there's an ovulation, that is, the woman or the girl has not ovulated, then you could have you could have problems with flow. That is, the flow may be the flow may be heavier. Then excuse me. Then also we have disease conditions that could make the flow to be heavier. Again, we go to our usual causes, that is hormonal imbalance. Like I said, when a doctor tells you you have hormonal imbalance, it means it is either too much or too low. All right? So if it is too much, it has consequence. If it is too low, it also has consequence. In this case, we also talk about polycystic ovarian syndrome. We talk about thyroid disorders. We talk about adrenal disorders, that is hyperadrenalism. The adrenal gland is in the body, in the abdomen, and when it is hyperfunctioning, you could have excessive bleeding. Now, aside from that, we could also have disorders of the blood, where you see the blood has the ability to clot normally, but for the blood to clot normally, it must have the complement of factors. We call them clotting factors that will bring this about. But sometimes an individual or some individuals lack the clotting factors, including some of the cells that promote clotting. So if your blood is not able to clot, then bleeding could continue for longer than necessary and in larger quantities. So people with clotting disorders or clotting factor disorders, or what we call blood cells disorders, especially the platelet. Platelets are a class of cells in the blood that promotes clotting. So when a woman is short of platelets or is suffering from platelet shortage, then bleeding is going to be more, menstruation will be heavy and prolonged. And there are some diseases that also have been recognized to cause as bleeding disorders. Now, aside from blood disorders, we sometimes a doctor puts some family planning, not oral contraceptives now, not the pills. I mean the IUCD or copper T, which is the example that you would understand more readily. This, as a side effect, causes heavier bleeding, and I'm sure those women on copper T or who have IUCD insertion would also may notice or may have noticed that their bleeding is heavier and more prolonged, and maybe more often than not with pain during menstruation. Now, aside from this, we have problems of the ovary, which includes ovarian cyst. Ovarian cyst Many of them are functional cysts. They also produce hormones. Many cause menstrual disturbance. Some will make it to be scanty, some will make it not to come at all, some will make it heavy. So hormonal issues because of ovarian dysfunction is another. We get to the womb now. I told you the womb is also very important. You can have infection of the womb. You can have masses of the womb. For example, fibroids. You can have polyps. These are masses. When they are present, they increase the area, the surface area for the womb, for the endometrium or lining of the womb to shed. And then so the woman bleeds more heavily for a longer period of time. Now, also you can have situations where the womb is cancerous, or there's cancer of the womb, cancer of the cervix. These are some of the causes of menstrual heavy menstruation. Now, can drugs cause heavy menstruation? Yes, the answer is yes, including drugs like the common aspirin. You know, aspirin is a blood thinner. When you take it, maybe for reasons of ulcer, peptic ulcer, and all that, aside from causing peptic ulcer, it causes also, it thins the blood, you know, and so that bleeding is much more, and then for a prolonged time. Other drugs that cause that would be drugs used by doctors to treat anxiety, to sedate patients, like Lagactil, which I believe some of us will be familiar with, and some drugs used for hypertension. This may cause heavy menstruation. Again, I told we discussed about stress. So stress and lifestyles keeps coming when we discuss menstruation. If a woman is having physical stress or emotional stress, remember I told you that this can upset the hormones because of the sensitivity of the hypothalamus in the brain to stress, and this can cause scanty menstruation. It can sometimes cause heavy menstruation, and at some times menstruation may not come at all, due to exercise. So we now ask, how do I know whether my menstruation is heavy? I go back to my initial definition of normal menstruation, that it must be the duration must be between 2 to 7 days. That is, it must not be less than 2 days. It must, but not more than 7 days. So if your menstruation is prolonged more than 7 days, and you are using more than 3 to 5 sanitary pads per time, then sometimes you use one pad per hour. And then there are clots in the that is giant clots in the blood, in the menstruum. That is the menstrual blood. Then you can say that you have heavy bleeding. What is the consequence, or what are the consequences of heavy bleeding? Now, the first is that once your bleeding is heavy, it is more likely to be prolonged and more likely to be associated with menstrual pain. So this is like a triple problem. Now, you lose blood, therefore the immediate consequence is that you can run to shortage of blood, which is called anemia. And like I told you, I said blood is not only important in carrying oxygen, it is also important in regulating and benefiting many biochemical reactions in the body that keeps us alive. So if you are short in blood, you feel sick, aside from the fact that you are short in blood and you feel drowsy, you feel weak. Sometimes you may not be able to, you are so weak that you cannot function. Now, what does it affect pregnancy? Yes. Heavy bleeding, because especially those that are prolonged, because you can no longer predict when you are ovulating, or ovulation becomes less predictable. All right, so pregnancy becomes less common, or the probability that you will get pregnant on time is less. So this is another effect of heavy bleeding. Another one is social embarrassment. Imagine a woman that cannot go out of the house because he doesn't know when she will get wet, or be so she's pouring and she cannot venture out because there's lack of confidence as to what will happen, or she's so weak that she's not functional anymore. So these are some of the consequences of heavy bleeding. Aside from the fact that, like I said, it will also, when a woman is short of blood, then it will affect other aspects of life. All right. So what do we do? What are the remedies? What do we do? Like as it were, that as we said of scanty bleeding, the remedy for heavy bleeding is to treat the cause. Doctors, and this is more important for unlike scanty bleeding, which you may still bear, when you have heavy menstruation and it is getting to the point that it is incapacitating you, you need to see the doctor. And what the doctor does is to listen to you, examine you, run some investigations, and make a determination of what is causing. I must say, however, that we are not able at all times to know or make a diagnosis of the cause. And we say it is, when we cannot make a diagnosis of the cause as doctors, we say such a bleeding is dysfunctional. That is, dysfunctional uterine bleeding. Excuse me. So the remedies are therefore directed at the cause. And what are the remedies? You have medical treatment for such, which will be to, like I said, the hallmark of treatment here is to give the hormone progesterone in form of progestogen and all that, to reinstate progestogen, which is the one that is mostly implicated here. And there are some. Excuse me. Yes. How many? 5 minutes. There are. Excuse me, please. So there are sometimes, because there is pain with the heavy bleeding, you may be given analgesics and all that. Some would land in hospital because the bleeding is heavy, it is ongoing, they are so bad and all that. You need to be admitted, and the doctors will give you drugs inside the drip that will stop the blood the blood in most cases. And the next is to correct the hormonal imbalance. After the test, we now know which hormone is causing the problem, whether it is too high or it is too low. Then we correct the hormones as doctors. But one drug that is also very important is the family planning pills. Excuse me. Like I said, as a side effect, one of the uses or one of the functions is to, aside from stabilizing menstruation when they are irregular and all that, they also reduce menstrual flow. They can reduce menstrual flow up to 50%. So family planning pills are very important in this type of situation. Then, if you have been taking drugs, for example, like I said, you've been taking aspirin and all that, we need to stop the drugs or substitute the drugs for a more convenient or more friendly one. For example, you can replace aspirin with paracetamol and it will still do the same thing. For drugs like chlorpromazine and some other antihypertensives, the doctor will look for an alternative that will be of help, that will not encourage bleeding. Then, like I said, many people who bleed because most of those menstruations have not been preceded by ovulation. So in this case, the treatment of choice will be to establish ovulation again. Now, so these are medical remedies, but we also have surgical remedies. Remember, I told you that the womb and the ovaries are very important in this. So problems with the womb, fibroid, we remove the fibroid. If it's a polyp, we remove the polyp. If it is bleeding is very severe and for a prolonged time and it's affecting your life, and you have completed your family in the sense that you don't want to bear children anymore. Remember that the most important function of the womb is pregnancy, is to bear babies. So you can remove the womb and you enjoy your life. Okay, there are certain so surgery is the other alternative. Then there are certain procedures that we perform as doctors to try and shrink the surface available for the uterus to bleed. So these are alternatives. And of course, sometimes when you have bled so much, you have derangement of blood clots and all that, you may need replacement of blood, and this will be done in the hospital. Now, as it is clear that heavy menstruation is more important than scanty menstruation, and anytime a woman is bleeding heavily, it is an indication for such a woman to go see the doctor, because blood is life, and it is important that ongoing bleeding, whatsoever may have been the cause, is stopped on time so that other problems do not occur. So I will now take some questions. I think I will take 5 questions, and then and of course, if I don't have the chance to answer your questions, please send these questions, connect with me on Instagram or Facebook, and I will do my very best to answer your questions. Question 1. Is there any relationship between the advent of heavy menstrual flows, and fibroid? Yes, I've told you that fibroid is one of the causes of heavy menstruation. I said in the talk that fibroid increases the total surface area available for the womb to bleed, which means that the womb has a more spacious area or a larger area to shed, and that means that the bleeding is prolonged. Of course, fibroid also causes irregular bleeding. Aside from the fact that it is heavy, it is also irregular. Question: can I differentiate between heavy flows and that of flow in fibroid? Well, yes, now, like I said, you need to see the doctor, but one quick low-hanging apple is for you to do a scan. If it's fibroid or other things like adenomyosis, where that is glands inside the muscle layer of the fibroid, or endometriosis, ultrasound scan is very useful. So it will diagnose in most cases whether fibroid is present or not. Question: I change my sanitary pad every 1 hour and it lasts for just 4 days. Is there something I can do? Yes, if you change your sanitary pads every 1 hour, that means that your menstruation is heavy, especially if the pads are fully soaked. That means it is heavy. And like I said, this is, you bled for 4 days, which is still within normal duration, but then probably bled for, lost too much blood. You need to see the doctor who would examine you and find out what actually is the cause of the reason for your bleeding. And it is this reason that would inform the type of treatment that you will take. I sincerely want to urge you to not to wait. From all that we have said about heavy bleeding, do not wait further time in seeing the doctor. Question: if stress could, I believe he's trying to say, if stress could lead to irregular menstruation, can a change of job or career be the situation? Yes, if this could be the situation, but I think a change of job or career is a big decision. I would rather you see the doctor first, and so that it is very clear that this is what is affecting causing the problem. But like I said, once you decide to, because one problem here is childbearing. Okay, you may go on leave for some time. Your menses is likely to become regular, and then you can bear your children. And remember that if you are a young woman, some of these issues will get resolved as you continue childbearing. Nevertheless, I would encourage you to go see the doctor so that you can have a diagnosis of the cause of your heavy menstruation or irregular menstruation instead of changing your job. Can Fervin be used during menstruation? Yes, it can be used during menstruation. As a matter of fact, it's one of the things we use for the pain for women who experience pain during menstruation. Ladies and gentlemen and viewers, I'd like to thank you for listening, and I hope you have learned. Now, the whole essence of what we are doing is to make you provide information for you so that you can also provide information for your family, your young girls, older women, your friends, and your community, so that public health is better served. This is the whole essence, and I hope we have enjoyed this all together. Thank you very much. The topic for next week is sorry, my crew members are cautioning me, but our next topic will be lack of menstruation, which doctors call amenorrhea. So let's get prepared. Thank you and good night.